Hello everybody, my name is Victoria Elsie and my presentation is on understanding autism spectrum. The DSM-5 defines autism spectrum disorder as persistent deficits in social communication and social interaction, deficits in social emotional reciprocity, deficits in nonverbal communication behaviors such as understanding use of gestures, lack of facial emotions, lack of pointing, lack of smiling, also deficits in developing, maintaining, and understanding relationships. This is related to wellness and health promotion because it affects how a person is able to express themselves, access healthcare, what's expected of them at healthcare appointments, and supported across the lifespan. As far as wellness, they can have difficulties with sleep, nutrition, physical activity, and stress regulation. Autism in adults can lead many adults not to make health appointments because of the anxiety that it can cause at these appointments. So definitely health and wellness is a huge factor that goes into autism, not only psychosocially, but also their physical well-being as well. People may have difficulty maintaining understanding relationships. Symptoms must be present in early development. These can occur with or without an intellectual impairment. This is why it's called a spectrum. People can be very mild and they can range to more severe. The pathophysiology isn't completely understood, but there appears to be genetic factors altering brain development, especially with the neuroconnectivity. And there is an epigenetic theory stating that the more closely tied you are to somebody with autism, the more likely you are to have autism. The genetic contribution is supported by increased prevalence in siblings, high coordinates with twins, increased risk with increased relatedness. For example, some actual physical numbers that I pulled from UpToDate are you're more likely, there's approximately 3% for cousins, 7% for paternal half siblings, 9% for maternal half siblings, and 13% for full siblings, 59% for monozygotic twins to have relation of autism. History and physical. Chief complaint: I feel like my child's not connecting with me or others very well. History of present illness. Logan is a 30-month-old, 2.5-year-old boy who's up to date on all his vaccines, well established with a pediatrician. He presents today with his mother, who's concerned that Logan's not interacting with her husband, or other adults and children in a way that she feels demonstrates social connectivity. This is not only affecting the mother's emotional state, but she is also concerned that Logan may have a lack of affection or interest in others. The mother is seeking guidance today and understanding what she can do to help Logan become more social. History and physical for Logan. He was born at 38 weeks of gestation, up to date on his vaccinations, and well established with a pediatrician. He was breastfed until 12 months old and then transitioned to whole milk. Delay milestones include speech, nonverbal gestures, pointing, smiling, and clapping. Medications, he does not take any. He doesn't have any known allergies. Social history, he lives in a non-smoking household. He stays at home with his mom during the day as she's a stay-at-home mom. Family history, mother has a history of asthma, father a history of ADHD, maternal grandfather died of lung cancer, and paternal grandmother has Alzheimer's. I'm not going to go over the entire review of systems. I'm only going to point out the pertinent positives. So as far as ENT, there is a concern for hearing as Logan doesn't reply to his name, and also when the mother tries to talk to him and get his attention, often he doesn't respond to her. GI, he has about 2 soft stools a day, but there is occasional diarrhea. Psychiatric, delay in speech, delay in nonverbal communication, lack of social interaction, difficulty going out in public. Mother endorses difficulty getting Logan to sleep at night. She often stays awake with him for about an hour, rocking him, soothing him, trying to give him a bottle to try to get him to go to sleep. Most nights she has a very difficult time with this. History and physical exam. Logan is a very well-developed little boy. His vital signs are within normal limits, and he is healthy on his growth chart, and he is gaining weight and height at a good pace. He does have a small abrasion to the left knee, most likely from playing. Psychiatric, he avoids eye contact during the interview with mom. And he also is isolated, playing by himself, not making very much attempt to look up at mom or look up at me, see what we're doing. Diagnostic tests and lab results. First, I want to point to the picture in this slide. This is kind of what you would see typically if you'd go to a psychologist office or child office to have these testings done. There's kind of a little area for parents to sit, area for the psychologist or pediatrician to sit. In order to interview the parents. And then there's toys, interactive games, things for the child to potentially and hopefully interact with during this session. Diagnostic tests include the Autism Diagnostic Interview, the ADIR. This is a screening tool of 93 questions for the parents or caregivers. Some things that are touched upon are social interactions, including eye contact, social smiling, peer relationships, shared enjoyment, response to others, communication and language, spoken language development, cognitive skills, use of gestures, imitation, pretend play, and nonverbal communication. And then there is repetitive behaviors and language. So are they having the stereotype movements such as hand flapping? Is there repetitive use of objects? Insistence on routines, sensory interests or sensitivities. These tests, typically this one takes about 1.5 hours to conduct. There's another test, it's called the CARS-2. This stands for Childhood Autism Rating Scale, 2nd edition. It tests 15 areas of behaviors. These include social interaction, emotional response, body use, adaptation to change, visual and listening response, verbal, nonverbal communication, activity level, relating to people, level of consistency of intellectual response. This takes about 20 to 60 minutes. It's based on direct observation of the child and interview with the parent, interaction of the child during play or tasks. That's why it's important to have some things for the child to do in the room or play with so that you can see kind of how the child's playing. Are they using imaginary play, making noises, kind of creating the play, or are they more so lining up toys, not really doing an imagination play, but more of a structured play. And then you can see if they're making eye contact, smiling, using those nonverbal communication tools as well, pointing to things, showing things to the parents or caregivers. Problem list for Logan includes lack of eye contact, preference to isolated play, he doesn't look at his parent for guidance, difficulty in social settings as the mom expresses when she takes Logan to the grocery store. He tends to cover his ears and screams. Lack of nonverbal communication, lack of creative play, and then those sleep disturbances that we talked about earlier. Some differential diagnoses. Obviously, autism spectrum disorder is my number one. ADHD, language disorder. You always want to test for hearing impairment as well. Some children may be delayed in these milestones because they're having difficulty hearing, the words being spoken or the sounds. They may not turn their head to their name if they are having difficulties with hearing. Social communication disorder, and then anxiety. Anxiety can play a big role into why some children get tested for autism spectrum disorder because they don't do well in those social situations because they are feeling rather anxious. Assessment. My primary diagnosis is autism spectrum disorder for Logan. Recommendations, treatment plan, and follow-up. The focus is behavioral and education interventions. This will target deficits in communication and social interactions. In my following slides, I'm going to have some different community resources that really hit home on these educational and behavioral things, trying to get children more in tune to social interactions and how they can handle these. Some psychopharmacologic interventions. There's different medications you can use for various aspects of ASD, including the hyperactivity component and attention if they're having aggression, anxiety, rigidity, repetitive disorders, depression, or sleep dysfunctions. In the case of Logan, we could potentially try medication for sleep. However, I'd like to conduct a follow-up appointment to further discuss this. We're kind of hitting a lot of different components with the physical, the interview, the testing today. So once I give mom like some more direct, clear instructions, I would like to follow up closely before we prescribe any medications. Anticipatory guidance really hit on safety. These children are at a high risk for drowning, wandering off, and fire safety. The wandering off, a lot of times it's coined as elopement. These kids will be doing fine. You think they're right beside you, holding your hand, and then turn on a dime and sprint. Most of the time, there's no malicious intent behind the elope. They're not trying to escape you directly, but a lot of times it can be due to anxiety, sensory issues, that or the child just is seeking a place of pleasure. Like maybe they have a friend next door and they really want to go see their friend, or the neighbors have a dog and they really want to go see the dog. But it can be rather dangerous, especially if you live close to a road. Um, so safety is, a really big thing that you want to stress to the parents and caregivers for these children. I want to have a follow-up in 2 weeks after the first initial testing, diagnosis, review of systems, physical, to discuss use of resources, medical home, nutrition for the children. A lot of these children can have issues with nutrition. Because they have sensory issues with the food. Some children, can only categorize one texture of food, like they only like soft or hard or dry or wet, and they have, a really difficult time getting those nutrients sometimes. Safety we just talked about, and then family support, use of those community resources, educating other family members on what autism spectrum disorder entails and how you can help and how you can interact and play with the child. After researching, I found an abundant amount of community resources and support groups. It was so easy to find 5. I'm just going to list these down. The Autism Ability Advocates Incorporation. There's their contact information. They basically promote health and happiness for those with autism. They use art, gardening, yoga. They offer after-school programs, parent training. Really good resource that's close to home. Vocational and psychological services is my number 2. Offers a wide variety of services for individuals with autism, including analysis, play therapy, social skills programs. They'll do tutoring for older children and young adults. They'll do work-based learning experiences and workshops. Number 3, positive steps therapy. This offers services for children with autism from birth to 21 years of age, including the screening, speech therapy, occupational therapy, and they really do hit a lot on nutrition guidance with the this one, number 3. Number 4 is the We Rock the Spectrum Cleveland. This offers sensory play area for kids with autism, special needs. They have like a really big gym play area. It encourages social skills and supports sensory needs is their specialty. So they don't have things that are too overstimulating for the children, and it offers some engagement for parallel play with other kids in a safe environment that isn't too overstimulating. Number 5, a total healing solution offers help for children with autism through exercise and play. It also integrates short stories and how to make friends. And here are my references. 3 of these were pulled from UpToDate, and one of them was pulled to find out my community resources, which I actually gathered from a link off of the DSM-5 called Autism Speaks. Thank you very much for listening to my presentation. I hope you enjoyed.